I'm a longevity medical clinic patient, and on Wednesday I had a stem cell treatment with Dr. Nelson on my lower back.
All right.
And I'm just wondering if there's anything I can do to kind of assist that process. And for instance, like urolithin or apigenin or something like that, or whatever other supplement would be helpful.
All right. If I were going to pick one supplement, I'd probably go with spermidine.
Okay.
Spermidine enhances the death of damaged cells and the formation of new cells. Okay, and it has a big impact on the mitochondria, provides a lot of extra energy. So spermidine is probably, if I had to pick one thing, that would be where I'd probably go.
I would proffer some input here as well.
Feel free.
I would think about vitamin D, which has been shown to actually assist stem cells in sort of getting into where they're most needed and joining in with the tissue. And, the whole reason that you're doing the stem cell therapy, it's going to potentiate those stem cells to a degree.
Yeah. And the other thing, since you're a patient of ours, I'm presuming that they carry your testosterone in a nice youthful range, because testosterone actually prevents the senescence of stem cells. Testosterone is an anabolic hormone, actually improves the number and the health and the activity of stem cells throughout your body. That's why it's so good at growing new muscle, new ligament, new tendon, healing and repairing, is the stem cells become far more active and doing their job better. And so that's actually one of the reasons that Dan loves it when our patients come for therapy, because they tend to do much better because they have robust anabolic hormone loads, and so they have better stem cells. and so what I was going to say is if you had told me, a week or two ago that you were going to come in, I just said, hey, why don't you ask your doctor to push your testosterone load into the upper range of normal. We normally try to carry an older man's free testosterone at about 150 to 180. Normal goes up to 210. And so when people that are going to get a stem cell therapy, at least 2 or 3 weeks in advance, I'd love to push those levels up closer to 200 or even that 210 upper limit for that period just before the transplant and then during the recovery period. And so for the next 3 months or so, I'd be happy to see you a little bit on the higher side, not abnormally high, but in the upper limits of normal, just to boost your healing and repair.
This is the value of our program, because we look at all of these parameters, whereas a lot of clinics, if they're even looking at testosterone in the first place, they're just looking at total testosterone most often. So we look at the binding globulin and the free testosterone that Dr. Mixon is speaking to. And so my point is, even with a high sex hormone binding globulin, you know that you have that, and therefore you know that you're safe to drive that total testosterone a little bit higher to compensate for it.